Bismillahir Rahmanir Rahim. Cephalosporin. This is the basic skeleton of cephalosporin. This structure is known as this one. Seven amino cephalosporic acid. The structure is consist of two fused ring. One is beta lactam ring and one is dihydrothiogen ring. Both ring must be in fused form. This is 1, 2, 3, 4, 5, 6, 7, 8, 9. Position number 1. Sulfur is usual but not essential for antibacterial activity because we having other beta lactam in which there is no sulfur. Sulfur may be carbon, sulfur may be oxygen, we can replace it. But in most of the cases, sulfur occupying this position number 1. This sulfur might be responsible for allergic reaction. Although the allergic reaction problem to the cephalosporin in comparison to penicillin is less. Position number 2 where 2 hydrogens are essential. In most of the cases, this is dihydro, 2 hydrogens. So they may not be substitute for ethyl, methyl, propyl, alkyl, and so on. If we replace these 2 hydrogen group by ethyl, methyl, propyl, or alkyl, any alkyl chain, maybe there is a problem of steric hindrance. Position number 3 is very having a key role. ये इंतहाई अहम है. If this position number 3 is occupied by this group, this is known as acetoxymethyl group, ATX. If this position number 3 is occupied by ATX group, so all ATX derivative of cephalosporin like cefuroxime, they will prone to acid hydrolysis. So they are mostly not effective orally because this ATX is converting into lactone cyclic ester. This ATX is converting into lactone cyclic form, cyclic ester, and that's lactone containing cephalosporin, they are inactive. So orally, ATX containing cephalosporin, they are not effective. However, we may improve the oral effectiveness of ATX containing cephalosporin by prodrug formation. For example, cefuroxime Axital, this is a prodrug. If this position number 3 is occupied by this special group, this is known as N-methyl, N पे methyl है, N-methyl 5 पोजीशन पे थायो ग्रुप है, तो N-methyl 5-thiatetrazole, this is known as MTT. If this MTT is here, so all the MTT cephalosporin, they cause hypoprothrombemia. There will be bleeding from mucous membrane, bleeding in urine, stool, from nose, from mouth, and there will be bleeding condition. For example, cefotetane, cefamendol, cefoperazone, these cause mucous membrane bleeding, especially in old patient, especially the patient whose diet is not balanced, because this MTT interacting with vitamin K requiring enzyme involved in carboxylation of glutamic acid residue after clotting factor 2, factor 7, factor 9, factor 10, and that's why they cause mucous membrane bleeding. but not all cephalosporin, only those cephalosporin which having this empty table. This carboxylic acid may be must be free. This is useful for prodrug formation. This hydrogen is replaced by long chain fatty acid to form a prodrug. This is also this group is also essential at position number 4. The double bond must be in between 4 and 3, not 3 to 2 1 etc. This must be present here. This double bond is responsible for geometrical isomerism and keep the molecule antique in fixed position. Position number 8, this carbonyl group inhibiting the beta lactamase enzyme as well as interacting with transpeptidase enzyme. These two hydrogen must be in cis form and no substitution is allowed here. By changing this, various derivatives are possible. The mechanism of action is just like penicillin. Thank you for listening.